Thank you for tuning in to OPM Live, which is an extension of Ordinary People magazine. How are you all today? I trust that your week was a great week, that you had an opportunity to do some of the things that you wanted to do, and remembering to wear your mask and 6 feet apart. We are still doing this. This is very important, not only to me, but also to you and to others, to always wear your mask and keep your distance. When you're traveling, when you're out eating, just, in public, period, we are still wearing our mask and being responsible during this whole pandemic. So with that, we are going to shout out our sponsors as always. And our sponsors are Vimashi Enterprise, Southern Eagle Music Group, Issa Rae's Vision, and Gemstones and Trinkets. Today we have an awesome show. We have a very important show, great information that is going to be shared about Medicare. And our guest today is Miss BonnieDobbs, and she is the expert panelist for the Atlanta Journal-Constitution, which is a newspaper. So with that being said, we are going to bring in Miss BonnieDobbs so that we can get some great information. I'm sure she has something awesome to share with us. Hi, Bonnie.
Hello, Verna. I'm so happy to be on here because you are such a mover, shaker, doer, and maker. You are a superstar. And so I'm very happy that you're having me on your show today. I know most people would rather have a root canal than to talk about Medicare, but I'm going to try to make it put in simple terms as best I can.
Okay, so if you don't mind, before we get to all of that, just share a little bit about yourself. And I know you got some awesome information to share with us.
Yes, well, I'm an entrepreneur. And I've been in different businesses. I was in the beauty industry for 15 years. I was in international export for 10 years. I've owned 2 car repair shops. So I also owned a singles group for business professionals, 40 and older. And then I got into Medicare. Now, nobody in their right mind wakes up one morning and goes, I think I'm going to get into that Medicare insurance. Okay. So there is a reason of our path that led me to that. So anyway, I just have always liked to own my own business and do my own thing. And nothing I have ever done has had anything to do with what I did prior. It's just, following your path and see what God puts in front of you and being open to closing a door and opening another door. So that's how I got here today. Networking has always been a big part of my life, starting in 2000. And so I've met so many other entrepreneurs and people in business for themselves. So that's kind of my backstory. I have 2 children, 2 grandchildren, and 2 great-grandchildren, and they keep me busy.
Wow, you have been very, very busy. That's awesome. So you are the expert in Medicare with the AJC, and that is the Atlanta Journal-Constitution. That's like a tongue twister for me. Not sure. Right. If you don't mind sharing with us, I have some awesome questions here that someone wanted me to ask. But let me see. The first one is, why did you choose to specialize in such a confusing program?
Right. Well, like I said, nobody wakes up one morning and goes, I think I'm going to get into Medicare insurance. So this is the backstory. So in 2007, I had decided to get my insurance license because basically I was retired, but I'm a very energetic person. I'll never be the type to just sit and watch the grass grow green. Okay. And so I thought that that was something that I could do part-time, and could still travel and so forth. So I get my license. Literally before I could write my first policy, my now deceased ex-father-in-law got dementia. Well, for one solid year, the year of 2008, I would go to see him. And whenever you go to a nursing home or memory care, the thing that everybody talks about and that are confused about is Medicare. So I want to be everybody's hero, right? And I just got my license. So I was like, hey, I'm going to help these people. I know insurance. This Medicare thing can't possibly be this difficult. And so I got to see firsthand how difficult it was. But the real moment that made me come to my senses of how confusing it is one night after being overseeing Mr. Miller, Helen and I were sitting at the table and she goes, I don't understand this Medicare thing at all. This one man comes in and he talks about how his plan is just nickel and diming him to death. And then the next person says that they make this high monthly payment, but then they don't hardly pay anything at all. And she said, but the real confusing thing is Mason and I don't pay anything for our medical treatment or our drugs. And I was like, well, my God, this doesn't even make sense to me.
Right.
So I started my journey into learning about Medicare. And I think that the reason why it was easy for me to learn it, other than I guess God had ordained that path for me, is because when I started reading about it and learning, I found out that a Medicare Advantage plan is the kind of plan, it's kind of like pay as you go. So if you're not having any medical issues, you don't have any out-of-pocket expenses. But when you do have something done, you do get a copay or co-insurance for every service. Okay? So then the family that said that they paid a high monthly premium but then didn't pay anything else, that family was on a Medicare supplement plan. Oh. So they do pay a monthly premium. It's kind of like pay a little as you go. Then whenever you have a major medical issue, you have almost no out-of-pocket expense, or you have very low out-of-pocket expense. And the reason why Mr. and Miss Miller didn't pay anything is because Mr. Miller had TRICARE. Now, this is from retiring from the military. So if you retire from the military, they pay for all of your medical expenses, and your drugs are very inexpensive. So I realized a mess whenever I saw it, and Medicare was a mess, it's an absolute mess to learn. So I just started learning everything I possibly could. And the next thing I knew, people were asking me to enroll them. People were asking me to speak to their group or their organization or to their church. And as crazy as this sounds, most people have always thought that I had some marketing group out there marketing for me to get all these speaking engagements. But as God is my witness, I haven't asked anybody if I could speak. They all come to me, including the Atlanta Journal-Constitution, approaching me and asking me to be their Medicare expert, which I am truly, truly honored, and I am truly blessed to have people put their faith in me to be their resource for Medicare. So I just am so passionate about what I do and about helping our seniors. So I just always thought I would just like drive around my little car and go from house to house and enroll people in Medicare, a little here and a little there. Oh, dear Jesus, he had bigger plans for me. Do you know what? I have an office. I have 2 employees. Carol Neal is one of them. And I have 16 agents not only in Georgia, but in other states too. And we're growing all the time. So, what was your question?
That is awesome. I was just talking about, how did you get into the program?
Yeah.
But that's awesome that God has such a bigger plan for you. And that now you are an expert in it. Because Medicare can be very, very confusing.
Oh, yeah.
I know when my mother was alive and she had Medicare, and I was like, you know what? I do not understand any of it. I mean, literally, like, Mom, I don't know what I'm doing, and
right.
I don't understand it. So it was like I just would just let Social Security do it, or let the doctors handle it whenever I had to take her to the doctor, because it was absolutely positively confusing. And then when it came to my turn to have it, I'm retired and all of this stuff, it was like, I don't know what's going on. And I hate going down to finding out about it because it's just too much for me. But to have someone who have actually experienced and know all of the ins and outs is really, really great. And what a great opportunity it is for you to share it with the aging community, and in such a way where we, I'm in that group of being 60 and above, can actually understand it and it don't be so confused. So what a great path and what a awesome opportunity that God has given to you. Okay, so one of our next question is, so we understand that you are the expert panelist at the AJC on Medicare, and what are the most important points you share in your seminars?
That is really a good question, because every time I do a seminar, I always ask whoever is booking that seminar, are there any specific questions that you want me to address that your group have asked you? So I can kind of tailor it, because Medicare is so massive, okay? And the good thing about me, though, is I know all the answers to this, so I have it up my sleeve. Well, let me back up. I want to really retract that sentence. I am not so arrogant that I think I have all the answers to Medicare, because anytime I ever introduce myself, I always say, hello, my name is BonnieDobbs, and I know a little bit about Medicare, okay? Because that topic is so massive. It just covers so much territory, and things are always, always changing. But whenever I'm doing the panel discussions for the AJC, what I try to do is answer questions that people ask me most of the time, or any new information that may be just being released from Medicare or the federal government, or, like right now we got open enrollment coming up, and we do have some new things coming down the pipe for 2021. So I try to address the hot topics, okay, and the ones that people ask me the most.
So when should you apply for Medicare, or is Medicare included with your Social Security? How do those two work together?
God, that is such a good question. People think that that Medicare is just automatic, okay? And so this is the way it works in the real world, okay? If you have started your Social Security, then they automatically send you your Medicare card out. Okay. If you're delaying Social Security, then you need to apply for your Part B. Now, your Part A will automatically start when you become Medicare eligible. Okay. And there's 3 times when you become Medicare eligible. One is whenever you turn 65. Okay. However, some people are on disability before 65. So if you are awarded disability, then your Part A and Part B will become effective sooner, okay? And then the other time you become Medicare eligible is if you are retiring and have employee coverage and you're retiring after 65. So those are the 3 times that you do it. But other than if you are drawing your Social Security, you need to apply for your Part B, as in baby, to start. Okay.
Okay. Now, is it necessary to that question just totally left my mind. Is it necessary to have the Medicare and insurance from your job? Do you need both of them?
Yes. Okay. So if you're talking about having you're talking about while you're working as an employee, or you're talking about once you retire and your company is providing insurance?
Once you retire, some people retire in their company insurance. They can carry it with them, or they can just not have it and then just have Medicare. I have some friends that have both, but seems to me that the company insurance, once they change over, is a little bit more expensive. So do you really need both, or can Medicare take care of everything you need?
Medicare cannot take care of everything you need, number one, okay? And number two, if this was about 5 or 6 years ago, I would say stay with your company plan, because the benefits and the cost is probably less than what you can get with Medicare. Now, since everything has increased in price, that's not so much true these days. And a lot of companies that did offer full retiree benefits, including your insurance, either they are not offering them anymore. Instead, they're offering like a retiree health savings plan or something like that, or they have reduced their out-of-pocket costs, increasing your out-of-pocket costs. So I always tell everybody, I can or my agents can review your plan. And we would need 2 figures, what your monthly premium is and what your annual deductible. And then that way we can compare it to an individual plan. So if your retiree plan is less with great benefits, we'll say stay where you are. Okay. But if we can save you money, we always say, we need to talk, give us a call.
Okay. Now with the Part A and the Part B, now what is the difference? But for those who may not know, the Part A and Part B. But I also understand that there's like a C, perhaps.
And a D.
Parts. Do you need all of them? And how do you get them in one package?
Okay. So Part A and Part B is considered original Medicare, and that pays 80%. Okay. So the way you get Part A is by working, and during your working years, you pay into FICA taxes. So once you've worked for 10 years, which is equivalent to 40 quarters, you have self-funded your Part A. So if anybody ever tells you Part A is free, go, no, I paid for it myself. Now it's free in the fact that once you become Medicare eligible, you no longer have to pay into those taxes. Okay. But you self-fund your Part A. When you become Medicare eligible, then Part B has a premium. And so for 2020, most people pay $144.60. Okay. Unless you're low income. If you're low income, there's different levels of low income. So depending on what level you are, you may get that paid for you through Medicaid, okay, a federal and state program. Or if you made more than, if you're single and you made more than $87,000, or married, filing joint, and you made more than $174,000, now there's a 2-year look back. So in 2020, they would be looking at your taxes for 2018. If you do make more than the 87 or 174,000, then you'll pay more for your Part B and more for your Part D for the drugs. So original Medicare Part A says hospital, but it covers much more. It covers you while you're in the hospital. It covers you while you're in skilled nursing or rehab. It covers you for hospice, and it pays all the blood that you may need if you're in either one of those environments. Okay.
Okay.
Part B says medical, but that covers everything else except for those three times that I was just talking about where it says hospital. So medical is your doctor's supplies. So do you need a Band-Aid? Do you need a joint replacement? Do you need stitches? Do you need brain surgery? Okay, so Part B pays for your therapies. It pays for your tests. Do you need a biopsy? Do you need an MRI? It pays for durable medical equipment. Do you need a walker? Do you need a wheelchair? So Part B, when it says medical, it covers a whole lot of territory. Okay. So once again, original Medicare is Part A and Part B. Part C is one of the ways that you can get coverage to offset those costs that original Medicare Part A and B do not cover. And then Part D is for drugs. Now, that was easy, right? Okay. And now, everybody has to have a drug plan. Doesn't matter if you're on medication or not. And if you're not, whether you are or not, if you don't get a drug plan, you will get a penalty. And penalties are for as long as you have Medicare. Well, how long are you going to have Medicare?
Forever.
As long as you live. That's right. So you don't want to get in trouble by getting a penalty. So now there's two ways you can get a plan to offset the cost of original Medicare. Hold on one second. Excuse me. One is with a Medicare Advantage plan. Mm-hmm. The other way is with a Medicare Supplement plan. With a Medicare Advantage plan, instead of going by the rules of original Medicare, a Medicare Advantage plan has all of the benefits of Part A and Part B, but you go by the rules of the plan. So you pay co-pays, like I was talking about earlier. You pay co-pays whenever you use it. Now, Medicare Advantage plans, some may or may not have a monthly premium. Okay, you would just have that co-pays whenever you used it. A Medicare Supplement plan, excuse me, helps offset the cost of original Medicare by offering a monthly, you do have a monthly premium, but then when you use it, your out-of-pocket costs are very minimal. Now, a Medicare Advantage plan has the drug plan built right into it, whereas a Medicare Supplement plan does not. You have to purchase a standalone drug plan, so you don't get that doggone penalty.
That is some awesome information. That has really helped me because I'm just flopping in the wind when it comes to this Medicare. I know absolutely nothing, but since I'm not, I don't go to the doctor a lot and all this other stuff. I don't want to see a benefit because I definitely need to know. Well, more than myself, I don't want to talk about myself, but those who may not know, this is great information. Great information that you share, because I'm sure there are many of us who really just don't get it and don't understand it and really probably just do not want to be bothered with it and just praying that we don't have to go to the doctor. So we won't have to worry about it.
Exactly. And I have spoke to millions of people, and I see some people so confused about this. You think that they're going to just spontaneously combust. It's like, oh my God, So that's another reason why I try to put it in simple terms. So I'm glad that you understood and could follow along with what I was talking about there.
Yeah, because when you go to Social Security and to get on the phone, you don't understand nothing they're talking about. And for me, it's just like, you know what? I'm just going to pay for my meds out of pocket. I'm not going to worry about all this other stuff and get done with it. So thank you so much for clearing all that up.
Sure.
What are the benefits? But you explain all the benefits of Medicare and the different levels and all of that. You explain it so well. And one more question that was given to me. What is Medicare covering for COVID-19?
Yeah, that's been a hot topic, really a hot topic this year. So whether you have Medicare or just regular Medicare or an Advantage plan, then it's covering the test. Now, It also covers any treatment, hospital, or quarantine that you need, but you do have to pay your co-pays and deductibles should there be any. Okay, so yeah, it is something that is covered, but you still have to pay your co-pays. Only the test is free.
Oh, so that clears that up.
Yeah, that's pretty, pretty cut and dry on that. Yeah.
Okay. Do you need to get some water? Are you okay?
Yeah, could we stop just 1 second really quick so I can grab some water?
Let's see. Do you have to go far?
No.
Go ahead.
Okay. 1 second. I'll be right back really quick.
We're going to allow her to get some water so that we can continue with this awesome information that she's sharing with us on Medicare. I'm sure there are many of you out there, just like myself, who don't understand all of this Medicare. And under her name says Medicare and other red tape. So she's very good at explaining. So we allowed her. So we really thank you for that. And you get your water. One other question is, what changes can people expect in 2021?
The biggest thing is insulin. Okay. So, many of the companies, as a matter of fact, I would venture to say most of the companies are going to be offering insulin. Now, this is not all insulins because insulins come in a variety of cost, okay? But your average insulin is going to be capped at a $35 copay. This is going to help so many, many people because, I mean, even last week, I had a gentleman call me and say, I can't afford insulin. I just got into the donut hole and I can't afford it and I can't live without it. And so I said, call your doctor and tell him exactly what you just told me. And so, and if your doctor can't help you, call the manufacturer direct. But so the $35 copay is going to be, like I say, with most plans, I strongly suggest that everybody get on the phone and call the 800 number on the back of your Advantage plan if you get your drugs through your Advantage plan, or if you have a standalone drug plan, call the 800 number on the back of that and ask them for 2021 because this will not start until January 1. If their plan is going to cover insulin at a $35 copay, and what insulins is it going to have the $35 copay? So the good news about it is if they do, it will be a tier 3 drug, but they will also be exempt from having to pay the deductible on it. So that is just the best thing ever. And even if they do get into the donut hole, their plan is still only going to charge them the $35. So I encourage everybody who takes insulin, this is so important, to go ahead and call the 800 number on the back of the card wherever you get your drugs plan through, and to make sure that confirm for 2021 that you're going to be covered. So I'm really excited about that. Really excited.
So the insulin is $35.
Most of them will on most plans. Not all insulins and not all plans. That's the reason why it's so very important that if you do take insulin, you call your particular company to find out. And if it doesn't, then you guys can give us a call and we can help get you on a plan that will cover your insulin.
Now, will there be a change for all medication or just the insulin?
Well, every year the insurance companies decide what tier they're going to put each medication on and what cost. And just like whenever you're under 65, usually there is an increase. However, sometimes there's not an increase. But if you are on a plan, before September 30th each year. So during the month of September, you'll get a little booklet in the mail, and it's called Annual Notice of Change, and it'll have ANOC at the top, and that's ANOC is what we call it, but it's Annual Notice of Change. And what it does is it has line item by line item of your current plan and comparing it with what the cost will be for the following year. So it starts out with monthly premium is this much for this year, and monthly premium is, so much for next year. Tier 1 drug is this much, deductible is this much, and you can just go down and look at it so you can compare. So if your plan is increasing or your medications have changed this year and you're on more expensive medications, then you would definitely want to change your plan. Or if you're on an Advantage plan and your doctors have changed, you want to, you would like to change that.
Okay. So, I think, is there a fee? This is the last question on this particular list. Is there a fee for your services?
No, me nor none of my agents, and I personally teach all of my agents. Okay, so talking to them is like talking to me. They're going to research your plan exactly the way I taught them to. Okay, and there is not a fee to use our company. And people say, well, how can you do that? So what happens is we're contracted with all of the carriers so we can compare all the plans in your service area. Well, these carriers pay us a standardized commission. So there is no incentive to put you on this plan rather than that plan. So what we do, our goal in life, okay, especially my goal in life, is to put everybody on the best plan for them. There's lots of different areas of criteria. We have a form called our discovery form that we get you to complete first. Once we get it in, we look it over. If we have any additional questions, we give you a call, and then we go to work trying to find the best plan for you. We schedule an appointment, and we go over our findings, and we can enroll you. Now, before COVID, I always spoke to audiences live, and that's what I like to do best. I think putting me in a box in a Zoom room, I just want to jump right through that darn window, okay, and come and talk to you and see you and look you eye to eye and shake your hand or maybe hug your neck. But I can't do that. And we also went, like I said, I thought I was just going to drive around in my little car enrolling people. Okay. We were also the company that came to your house or met you at the nursing home if you had a loved one that was in a nursing home or a memory care, or would meet you at a coffee shop or wherever you felt most comfortable. We have all, because of COVID, had to change the way we do business. So now we can do it over the phone. We can do it via Zoom. So staying safe is most important for all of us, especially if you are Medicare eligible, and I am, and I have a couple of other medical strikes against me. So it's very important that we be our own best mommy and practice safe measures. Okay. So I know there's a lot of controversy about wearing masks and doing this and that and the other. Let me tell you something. I've got 3 strikes against me, okay? And so I'm going to do what is the best thing that I should do to take care of me. And I strongly, strongly suggest everybody do what is the best to take care of yourself. So even though we're this age, be your own best mommy and take good care of yourself.
Absolutely. That is so true. I know for me, that mask, I think I stay in the house so much so I don't even have to have it on. But, when I go out, then I have to have it on because that's what's given to us at this particular time. And until everything is, I can't even say go back to normal, but at this particular point, yes, you're absolutely right. Be your own best advocate for your own safety and your health. But not only just for you, for yourself, but for others as well. We have to really think about people when we're out and when we're close. And you just have to be a responsible citizen, basically. Just be a responsible citizen.
I agree. I agree.
Just be responsible. Well, Bunny, I mean, I could talk forever about Medicare, but you have shared some awesome information with us, and I'm sure there will be some questions later on. But at this time, if you can share with our audience how they can connect with you, if they live out of state, is it possible for them to call you? And even out of state, how they can set an appointment with you, even do an event with you on Zoom. I know you don't like the Zoom, but you explain it so well that, I mean, you explain it so well. And it would be, if they are out of state, how is it possible for them to contact you?
Sure. So our telephone number is 770-373-7541. Or you can go to BonnieDobbs.com, BonnieDobbs.com. Or if you're a good speller, you can go to MedicareandOtherRedTape.com. That's a little long. Anyway, it'll take you to the same landing page, whether you go to BonnieDobbs.com or MedicareandOtherRedTape.com. There's a place in there where you can also, our phone number's listed on there, but you can also send us an email and inquire about information. So that number again is 770-373-7541. And I always like to end with a little one-liner. So today mine is, sunshine is the best medicine, and it doesn't come with a $35 copay.
I love it. I love it. That is so great. That is so great. Although I really do not like being outside. Sunshine is very good for you. Well, Bunny, it has definitely been a pleasure having you on the show and sharing such great information, as I said before, because I'm quite sure that there are someone or many who just did not understand or do not understand Medicare, and that you was able to explain it to us so eloquently and just in very great simple terms, and all the A, B, C's and D's and all of those things that go with it, that we understand it even better. And so again, thank you so much for being on our show, and we look forward to hearing from you again.
Thank you very much for having me, Verna. You have made this an absolute pleasure.
Thank you, Bunny. Have a great day.
You too.
We definitely thank Ms. BonnieDobbs for being on the show and explaining to us Medicare and the other red tapes. And as always, we share in our reading. And of course, we're reading from Jesus Calling, Enjoying Peace in His Presence. And that's by Miss Sarah Young, and today being October the 10th. And it reads, trust me enough to let things happen without striving to predict or control them. Relax and refresh yourself in the light of my everlasting love. My love light never dims, yet you are often unaware of my radiant presence. When you project yourself into the future, rehearsing what you will do or say, you are seeking to be self-sufficient, to be adequate without my help. This is a subtle sin, so common that it usually slips by unnoticed. Wow. The alternative to live fully in the presence depended on me each moment. Rather than fearing your inadequacy, rejoice in my abundant supply. Train your mind to seek me, my help continuously, even when you feel competent to handle something by yourself. He's saying seek him. Even though you feel comfortable or competent, seek him. Don't divide your life into things you can do by yourself and things that requires my help. Wow. Instead, learn to rely on me in every situation. This discipline will enable you to enjoy life more, to face each day confidently. And the scriptures are Psalms 37, 3-6, Philippians chapter 4, verse 19. And that is from the New King James Version. That's where those scriptures are from. And so again, thank you so much for tuning in to OPM Live, which is an extension of Ordinary People magazine. And until next time, be blessed. And as always, love, peace, and increase. Thank you so very much. Have a great day.